Hello, everybody. Welcome to HeartBrief, another episode, a weekly episode to bring you some very exciting new medical research that hopefully will make an impact on your life and your practice. I'm Joel Kahn, medical doctor, triple board certified preventive cardiologist, and clinical professor of medicine. So let's get underway. Oh, let's do the big one, the one that I really hope you do. Go search this article down and look at it in detail. And this was published in a very fine journal called JACC, Journal American College of Cardiology, within the last few weeks. First author, Michael Miller. I do know a number of the authors, quite prominent nutrition experts, cardiologists. A clinician's guide for trending cardiovascular nutritional controversies in 2026. And they felt they needed to analyze and respond to trends you see, particularly on social media, influencers, even our Secretary of Health and Human Services is contributing to questions, sometimes confusion, about what is the optimal food choice, plate, diet. And this central illustration has their conclusions reviewing the data. I could go and look how many references are in this paper, but there's a lot. You can see in the orange column to the left, foods that have evidence of harm, limit or avoid that are in the news. Beef tallow, rich in saturated fatty acids, increased LDL cholesterol, causal risk factor for atherosclerotic cardiovascular disease. Number two, no controversy, ultra-processed foods, promoting calorie overconsumption, impacting the microbiome, worse cardiometabolic health. Number three, artificial sweeteners and sugar alcohols like erythritol as a sweetener associated with increased major cardiovascular events. Warning, warning in the use of erythritol found in many keto foods, so careful. How about lack of evidence for harm or benefit? Full fat dairy, medium chain triglycerides, like some people are adding to their coffee and smoothies. And finally, monk fruit and stevia may be beneficial given their high antioxidant content. They've not been associated with cardiovascular risk. And then you get to the green side, and you'll be surprised what's at the top. Seed oils are okay, recommended. High in unsaturated fatty acids, PUFA and MUFA, associated with lower risk of cardiovascular disease. Polyunsaturated fatty acids, however, can be oxidized by light, air, and heat. So you need a dark glass bottle and keep these stored in a cool situation. And finally, seafoods. Not too much controversy except for the potential contamination with mercury and other DDT, PCBs, as well as the ability for some fish to raise TMAO levels in the blood, which is a commercially available blood test, TMAO, Quest, LabCorp, and others. And certain fish, certainly like cod and haddock, rarely salmon, but occasionally salmon, can raise TMAO levels. So generally, seafood's going to get a pass as a healthy choice. So I encourage you to seek out this paper, which is available to read. The PDF's available without any subscription. State-of-the-art review. I think you'll find it'll help both your own food choices, understanding these influencer trends that are all over social media. And I don't think they're doing a whole lot of good for the public. I think they're confusing the public mainly. All right, so let's go to another one that's food-based. Always fun to talk about food. This is far from a perfect study, but it caught my eye. April 8th, 2026, Frontiers in Nutrition, Health Associations of Various Fruit Forms, Solid Fruit Juices and Smoothies. And this was a survey of 443 individuals that indicated if they ate fruit, how they got fruit, solid fruit, fruit juices, or fruit smoothies, and their own rating of their health. Their answers to questions about did they have high blood pressure, did they have mood issues and mental health disorders, how was their energy level. In general, the group that said, I prefer to get my fruit from smoothies, had the best overall health self-reported. Now, there may be 25 other reasons, and maybe it has little to do with the smoothie, and maybe, choosing a smoothie carries with it other healthy habits. But at least the smoothie was related. And in contrast, and of some concern, fruit juices had the poorest outcome associated with a higher cholesterol level, according to the self reported answer, poorer sleep quality, and the highest rates of cardiovascular disease, although it was only 16% of the cohort. So while self reported data and potential confounders conflict and pose limitations, findings underscore the need to differentiate fruit consumption in dietary guidelines, retaining the fiber, which is, of course, in whole fruit and smoothies, while enhancing nutrient bioavailability. Fruit smoothies may offer unique health benefits. I indeed had a fruit smoothie for breakfast this morning. I had a big handful of spinach, blueberries. I had a pea protein based protein powder. I had a couple tablespoons of ground flaxseed. Um, I think that was it. It was delicious, delicious, and nutritious, and reasonable benefit between a formula that's out there which says health equals nutrition over calories. So that smoothie was full of nutrition and relatively light on calories. It's a good way to maintain your weight. And finally, let's go to pharmacology here. Just published article in press, April 11th, 2026, in the journal Scientific Reports. A drug that maybe you don't use that much in your practice, and maybe you're not a cardiologist. Ranolazine used to have a brand name, Ranexa. Unusual drug, nothing else like it, and that it's believed to improve the deformability of red blood cells. So your red blood cells can literally bend, turn, and fold and get into diseased areas that stiff red blood cells might not be able to get into. And so there has been the FDA approval of using ranolazine to treat angina and various chest pain syndromes. But how about something called a myocardial bridge? You're having discomfort on effort, you fail a stress test, you go for a cardiac catheterization or a CT angiogram, and you can watch, usually it's the LAD, being compressed by a piece of myocardial muscle on top of the artery. It's always there, but there are cases where that amount of myocardial muscle is more prominent. So you can watch the artery get obliterated and then during diastole fill, obliterated and fill. And some people do have angina with it. So in this study out of Iran, they took people with double-blind randomized studies, so we got to give them credit for that. 52 people with angina and a myocardial bridge receiving beta blockers, that's the usual therapy, and given either Ranexa 500 milligrams twice a day or placebo. Significant improvement in angina on Ranexa. No side effects, EKG, QT interval, PR interval, QRS interval, ejection fraction equivalent. So their conclusion was ranolazine or Ranexa as an adjunct to beta blockers significantly improved angina symptoms in patients with myocardial bridging. Another group that I use it in, I did see a patient this week with a syndrome called MINOCA, myocardial infarction normal coronary angiogram, MINOCA. These are challenging, and we believe some of them have small vessel cardiovascular disease. You can't image that, but that's the belief. And Ranexa, ranolazine, along with occasionally calcium blockers, because there might be a concern of coronary spasm having resulted in the angina. But at any rate, ranolazine, Ranexa, inexpensive drug, well tolerated, comes in 50 milligrams, comes in 100 milligrams. I always, of course, start with the lower dose, see the response, and see if we need to up titrate the number of milligrams a day. So I hope you enjoyed HeartBrief with me. The controversies in nutrition, the controversies about smoothies and fruit juice, and a little update on an older cardiac medicine that's still around and worthwhile. Thank you for joining me. We'll be back next week.